Hi, everybody. Good evening. Hope you all are well tonight. I have a surprise for you. Tonight, I have my friend Dr. DiPaola joining me for my chat. And for all of you who don't know me, I'm Debbie Lano. I'm the creator of The New Ageless Woman, and I'm a certified integrative health coach and a yoga teacher. And I love to talk about topics that are of interest in the areas of health and well-being and all of those things. So tonight I have Dr. John DiPaola with us tonight, and we're going to talk about using the body to heal the body, and that's pretty exciting. And just let me tell you a little bit about Dr. DiPaola. He's a chiropractor at Everybody's Health in Mason, Ohio. He's got over 25 years of experience in his field. He graduated from Life Chiropractic College in 1995, and in recent years opened up a new clinic within his practice with his fellow doctors and a medical team devoted specifically to regenerative medicine, which is our topic tonight. And so, Dr. DiPaola, thank you for being willing to come on and share with us your knowledge about this field. So,
thank you for having me on.
Oh, you bet. We've been actually trying to plan this for a while, so it's really good to have you on. I'm glad this all worked out. Let's start off by just finding out what is regenerative medicine for those in the audience who don't really understand what that is or don't have any knowledge about it. Just help us understand what regenerative medicine is.
Well, we're trying to help the body heal naturally, so that could take us on a lot of tangents. But we use, I'm sure many people have heard of stem cells. We use stem cells. We use other regenerative medicine products, things associated with that. I guess I can give you a definition of it, and we can go from there. The World Health Organization defines regenerative medicine as the science of replacing, engineering, or regenerating human cells, tissues, or even organs for restoring normal function. So if we kind of take that apart and really see what it means, is we're helping the body heal itself by utilizing stem cells, really is what it comes down to, but helping the body heal by replacing and healing tissue. So in our clinic, we use regenerative medicine procedures to help heal degenerative joints by growing.
Oops, we lost you there for a minute. We got frozen for a bit.
Yeah, I'm losing you.
Yeah, we got frozen just a little bit. I'm sorry about that. So there are two primary methods I know that you're using at Everybody's Health, which is PRP and stem cell therapy, umbilical cord stem cell therapy. So let's just start off by you telling the viewers or help us understand what PRP means, what it is, what it does.
PRP stands for protein-rich plasma. Protein-rich plasma, meaning we take the plasma portion and separate it from the whole blood. So we take a blood draw, it looks like a typical blood draw, and the PRP is separated and injected back into the person at the injured area or the degenerative joint.
Wow, okay. That sounds pretty easy. I mean, that sounds really not complicated at all, and pretty cool that you're using your own blood to do that.
It's not complicated. Yeah, and it's a very simple procedure.
And so getting to the next one is stem cell therapy. And I know that there's a lot of controversy around stem cell therapy. And to be clear, this type of stem cells that you use at Everybody's Health is umbilical cord stem cells. And of course, you can use adult cells, but we'll talk about that later. You can tell us what's involved with that. But let's talk about what you're using at Everybody's Health. And if you could help the audience understand, where do newborn stem cells come from? Because I know there's a lot of misconceptions out there. So help us understand what that whole process is.
Okay. Well, they are adult cells as well. So I guess that's one misconception there. They're not cells of the baby. The cells we use are called mesenchymal stem cells. They come from the umbilical. If the parents decide to donate, they're tested prior to, and it happens at a C-section, so it's planned out. So everyone's tested prior to. We take the sample from the umbilical cord that is sent to the the lab where it's processed. It's screened for infectious disease according to the American Association of Tissue Banks. So it is a safe process. The cells do not come from aborted babies or it's a full live term or full live birth, full term birth.
Very good. I know
What was your
there's
other
been
question? I'm getting
controversy.
lost in my answer with you.
Yeah, no, you're good. You're good. We
There
did
is
lose you for a
controversy.
minute. Yeah, we lost you for a hot second there, but you're back. So
Okay, I've
I
lost
think,
you a little bit too.
yeah, I got frozen a
Okay.
little bit. So I think it was just that I think when you were mentioning umbilical cord, that kind of froze a little bit. But so we're on track with you. So it does come from the umbilical cord, and it is screened first for health reasons. It's screened. We did get that. And so I guess the next question some people might have is, are there any matching requirements? Does it matter where it goes or who it goes to?
There are not matching requirements. The stem cells contain a molecule that makes them immune privileged. Therefore, there's not any matching requirements for the person that would get the transplant. The transplant would not be rejected.
That's very cool. That makes them really universal, and that's really great to know. Um, so I know that you don't do this at your clinic, but if you could help our viewers understand, if they were to use their own stem cells, if they were to make that kind of a choice, what would be involved in that process for them?
There are clinics that do that, and it can be an effective process. But so, what is the process of getting them, or
Yeah, how are they,
what was your question?
how are adult cells harvested? If you're going to
Okay.
use your own, if
Well,
you're going to use your own.
if you use your own adult cells,
Yeah. Mm-hmm.
it's taken either from bone marrow or it's taken from fat. So it's a procedure where the cells are taken from bone marrow, literally from the bone, or it's taken from fat, which is similar to a liposuction procedure. So they're pretty invasive procedures.
I've had neither before. I've considered liposuction, but never went down that road. So, but I have heard that it's painful. So, yeah.
Similar, but not exactly the same procedure.
Okay. So, in your opinion, what do you think the advantage is to using the mesenchymal stem cells, the umbilical cord stem cells, versus using our own? What would be the advantages?
I would say the potency of the cell, the ability to heal. The umbilical cell is coming from really new life. It's brand new, and if we were to compare that to, say, if I were to use my own fat cells for regenerative medicine to get the stem cells, on using my cells of my age, which are not going to heal to the same ability that the new MSCs would.
But that just makes sense to me. When I think of viability and thriving and all of that, that totally makes sense. So let's talk about the different conditions that stem cell therapy or PRP can really, really help. What conditions do you see at the clinic that can benefit from this type of approach?
Well, we deal with primarily orthopedic conditions, so we're dealing with degeneration. That could be degeneration at a knee or a hip or even the spine. We work on shoulders. It could be wrists. It could be hands. Soft tissue injuries could be dealt with, and that could be a new injury. Athletes commonly use regenerative medicine, especially PRP, to help heal the soft tissue, help heal the sprains and strains faster. Or it could be used with PRP alone, or it could be used with stem cells for, say, an older soft tissue injury that just hasn't healed properly. Maybe a rotator cuff tear or a rotator cuff strain, for example. And typically, people deal with that for years before they really get some form of intervention when it becomes more limiting. It's a great example of where we can use that. But often we're simply working on degenerative joints. For example, a knee replacement, a bone-on-bone diagnosis of a knee. That's somewhere we would look to really grow new tissue within that joint to help restore normal function.
Well, that's very exciting. I mean, I would much rather do that than have a knee replacement if I had the opportunity. So That sounds,
Yeah.
I've seen a lot of people go through the after effects of knee replacement, and there's such a period of time to recuperate from that. It is just uh, has really kept me from making that kind of choice anyway. So it's good to know that there is an alternative that's not so invasive.
Not
I,
nearly as invasive.
yeah. You bring up rotator cuff, and I hadn't even really thought about that because I know several people who have had rotator cuff
Mhm.
issues from whatever their careers or the work or sports or whatever. And so, wow, you've seen some good results from people that have rotator cuff injuries.
Yeah.
That's
Yeah.
awesome.
Yeah. Just it's really to start healing that soft tissue that just never healed properly in the first place.
Gotcha. Or yeah, I could see, if you've had an injury, kind of putting off doing something about it because of the time down. So
Hmm.
I think
Exactly.
regenerative medicine. Yeah. I didn't even think about that, Doc. I mean,
We
just
don't
the
have the
idea.
downtime that one would have with a surgery.
Yes. I think that's a super big plus to this type of approach, that you don't have that downtime. You can go right back to work. Not that you want to, but you could.
Not that you want to, but you could.
Oh man. Okay. So it sounds like this would be a really good choice, a really strong choice as an alternative to, say, the route of surgery, medication, injections. This this is
That's
a
why
good
we're doing what we
choice.
do. Yeah, exactly. I mean, typically people go through the common medical route as medications, which may cover up the symptom. They may take medications to reduce inflammation, use steroids to reduce inflammation, but steroid has its negative effects. That's why they can only be used so many times in a certain area, because it really starts to wear away the joint. If someone opts for a surgery, or even if it's that severe, if they've let it get to that point, and of course they have the downtime, potential potential ill effects of the surgery or any possible complications. Really just trying to
Right.
do is to help the body heal naturally without those invasive procedures.
Exactly. Exactly. Wow. Um, okay. So I forgot to ask you about the neuropathy because I know several people that I know are dealing with neuropathy. And would this be a
Mhm.
possibility? Would this be a good choice to try for someone who's got that condition?
It can be. The PRP and stem cells both can be used with neuropathy, sometimes in combination, and there are other regenerative medicine products that can be used too. Really, just to build the proper treatment plan for someone. But with their with neuropathy, they're pretty limited. It's limited to just
Hmm.
medication and potentially physical therapy, which is okay, always just to help someone function better. But our goal will be to help the nerve to heal, and then therefore to function better.
Gotcha. We have a question from one of our viewers. It came in from Pam Ferber. And the question is it
Wow,
injected into the joint that is affected?
it is. It's injected straight into the area that's affected.
Okay. Okay. Good to know. Thank you. Thank you, Pam, for your question. For anyone else who may be out there, feel free to ask questions. That'd be a great thing to do. So let's talk about the expectations. Let's get that right. So what should we expect in terms of the length of time that it would take to heal from this type of therapy or this type of approach? What would one
Typically 6 months.
expect?
There's not an exact timeline I can give for anyone because everyone's going to heal differently. It's going to depend on a lot of things on their healing ability. But we need about 6 months or so, even a healing that we can get from regenerative medicine. So it's not an instant change necessarily. Sometimes people see good symptom changes early on, but that's not the
Hope you're frozen.
no
Whoops.
have.
Sorry, folks.
Yep, it frozen.
Yep.
Now
Yeah, you
I
were
think you're
frozen a
back.
little bit there. Oh, wow. Okay, so about 6 to 8 months is what I'm hearing,
Mhm.
just to allow the body to take its course and integrate the material and to really start the healing process. So I know in your practice, and I really respect your profession, by the way. I've respected chiropractic for a long, long, long time. And I think it's really
Definitely
exciting.
a
Can you
loyal
tell us
follower.
what, yeah, could you tell us or tell me or tell us what inspired you to go the route of regenerative medicine? Because I think you
Well, I,
probably only can
you
go
know,
so far. Like you could only
kind
get
of
people
lost you there
so
with that last
far.
part.
Yeah, you can.
Oh, I
I'm
see what you're
sure
saying.
that,
Oh,
yeah, to some degree, I know that you
but
can only go so far with people with chiropractic. And then would you say regenerative medicine would be a next best step?
exactly. I mean, with chiropractic, we're trying to let the body heal naturally, let the body function better and to heal as well as it can on its own. And we still have some limitations. And the obvious limitation is when people age, they don't have the same healing ability. With regenerative medicine, we can help enhance that. So, in a sense, it does pick up off because we do amazing things with chiropractic. But when someone has a severe degenerative condition, we can really help it with regenerative medicine, where the body on its own just is limited.
That's super good news to hear. That's very good news to hear. So, wrapping it up, if somebody were interested in this alternative type of healing process, regenerative medicine, what would their next step be, Dr. DiPaola?
It
What would they
really
do?
be for it would be for us to determine if they're a candidate for one thing. We have a consultation with anyone who's interested in regenerative medicine just to see if what we do can help them. So we go through their health history, we go through their condition, we review any of their medical information they may have because people have already, quite often, if they've reached this point, they've already been through a lot. So they may have some medical information, some diagnostic testing or and so forth. We review that. If we need more, we get more images. We order that. We put that information together and see if we can come up with a treatment plan. If we feel that they're a candidate, we have them evaluated by our medical team. And if all goes well, then they start the procedure.
Well, I think that's really great. I think that makes me feel real good. The fact that you screen everybody so carefully before they enter into that decision to go through with that. So that's really good. Um, wow, a lot to think about here. This is a very exciting field. I've been personally waiting for this to become a thing for a long time. So, what would your parting message be to our viewers tonight?
Wow. Um, I'd like them to know that they have hope if they've had a problem, had an issue where they've had treatment and they want. And I want them to know that they can live the life the quality of life that they want to have and to be active and to be functioning and not feel limited without necessarily having to have an invasive procedure, or even if they've had
Hmm.
that procedure and it left them still with some limitations, that there's really still hope.
There's still hope. I love that message. I always love those messages of hope. You know, I am really big on that. We have another. Oh, Pam just tuned in with another comment for you, Dr. DePaula. Dr. DePaula does a great adjustment, and I can attest to that.
That's great to
You're magnificent.
hear.
Yeah,
Hi, Pam.
yeah. I can I can remember many times coming in and going my neck or my back, and you just have the magic touch. So thank you for that. Thank you for all your work, and I thank you for your 25 years in this field. It's such a near and dear to me. This field of helping the body heal the body. I think it's wonderful, and I really appreciate you. So thank you so much for coming on tonight, and I hope that we'll
Thank
do
you.
more things. I hope we'll do more talks together on topics that you're passionate about, that you know have things to share with us. So that'd be wonderful. So.
I'll
Thank
be
you.
looking forward to it. Okay. Thank
Absolutely.
you.
Thank you. Thank you, Pam, for your comments. Thank you, Doc, for
Thanks.
coming on and sharing a little bit of your night with us. And until next time, good night. Bye now.
Good night.